given the business that CAST and Galorath are in, we became kind of obsessed with HealthCare.gov and its challenges because there was a lot to learn on behalf of our customers and for ourselves. And this summarizes our presentations today, what we have learned, and hopefully it will enrich your own practice. I'm going to start the presentation with a infographic prepared by consultant Eduardo Garcia, which really nicely lays out the system at a high level, the technologies and the contractors involved. You've probably heard about a few of these things already, 55 contractors, all the providers, all the contractors, CGI, QSSI, and others involved. And also maybe you've heard about some of the technologies as you go down this chart. You can see some very common technologies which were utilized on this site. For those of you who are a bit more technically inclined, CMS, Center for Medicaid Services, was kind enough to prepare a presentation a year back which showed the architecture. It's essentially a 5-tier system, which you might expect of an enterprise-level system like this that had a lot of clients to serve, computer clients. On the bottom, we have a data warehouse, and then they're using JBoss throughout for messaging between tiers. And towards the top, they actually serve various providers, not just, of course, the website, but also the state exchanges and the other providers who use phone and email and other services to answer potential subscribers' questions. Everything gets served out using a content delivery network, Akamai, and to handle high-load systems such as HealthCare.gov, of course, they have web load balancing. So this was a pretty standard architecture for a site like this. It's what you would expect in a high availability system, and it's the level of tiers you would expect when they need to serve as many services as they need to. At the lower left-hand corner is the much discussed data hub, which used FTP, messaging, and web services to communicate on the one hand with other state exchanges, and on the other hand with the agencies that it required data from. In our infographic, we stated that the cost of the site was $150 million. We got that number by going through the GAO report on HealthCare.gov. We went through USA Spending. We went to other places, including contacting the authors of the New York Times article, which talked about the cost. And we eventually found that the best reporting on this and the best person to put together these numbers was at the Washington Post, the fact checker. When that person revised his number to $300 million, we backgrounded that number, and we found that $300 million approximately was a good cost figure for the website and related technologies to date. That doesn't include extended development on call centers and other aspects of the healthcare rollout. This, when fully funded, may go up under current numbers to $600 million, but the contractors haven't taken all that money out of the bank yet. So the current number is $300 million, which changed some of the numbers in our estimate. Instead of a project that would take about 1.3 million hours, we figure $300 million will buy you about 2.7 million hours of contractor time, taking just over 3 years. As I give you these numbers, you can compare against what you've heard in the news when ACA was approved, the Affordable Care Act, and when the whole project got underway. And they kind of make sense, about 3 years, given that it was 2010 and it's now 2013. Interestingly, we also predict now that the system at nominal rollout went with about 4,900 defects. We back-trace the numbers. We took the $300 million, we plugged that into CRSIM, and that's how we got these numbers that we've shown you on the infographic and that we updated. If you look at the CRSIM charts, you can see the staffing level taking off from the start to about 800 people. If that were flat, the number would be a little lower than that. And you can see that the blue on the charts is the 50% line for 4,900 bugs, 22.7 million hours, 34.4 months, about 3 years. However, there's a risk distribution on these, so that's the 50%. If you really want to deliver a high-stakes, reliable system, you're going to go up in those probabilities, taking you more time, more people, and of course reducing the number of bugs you have as you take more time. In fact, when you deliver at the black line here, this defect profile shows the defects over time, and the black line shows the delivery time at 3 years. You're not delivering a low defect system. You have to still keep on going until you get those defects down to an acceptable level. So HealthCare.gov is a textbook example of delivering too early. What went wrong? Why did this thing get messed up? Well, first of all, you had requirements volatility. When this system was nearly in the can 6 months ago, they asked for an eligibility requirement. So in order to see your plans, you had to actually go through verification. A huge, huge new requirement that was laid on at the very end. You had a Supreme Court case that nearly invalidated the whole Affordable Care Act. You had states, one by one, falling out from participation with their own healthcare exchanges and relying on the federal government. So requirements of volatility was extreme, all of which would, of course, lengthen the project. You had complexity. I thought our aerospace customers had hard problems to solve, but this complexity just pervaded the system. For example, contractors spent 2 weeks sorting out how to handle weight loss surgery. Imagine that was just one little question of a much bigger system. This chart, prepared by a congressional staff, doesn't even get at the full set of actors and participants in the system. You had a lot of integration, a lot. For example, programmers wrestled with a problem that snagged naturalized citizens needing DHS, Department of Homeland Security verification. So every system they integrated with would have had issues. I mean, these are stovepipe systems for the most part. They may be able to handle internal operations very well at Social Security or DHS, but those are all internal. And they were asking these systems to all integrate with an outside system in real time. You have verification of Social Security, you have citizenship verification, incarceration status, household income, lawful presence, Medicaid, CHIP, TRICARE, Veterans Health Program, even the Peace Corps got factored into this integration. So huge problems here. I mentioned that these were legacy systems. You're operating at web speed with HealthCare.gov. You're measuring response times in seconds. However, on the back end, these are not systems that were designed around response times in seconds. Some of them were batch systems. So how do you mate batch systems with a system like HealthCare.gov? Very difficult problem. And you lay all this on a forced deadline. Given the complexities of the system and its integration issues, was October 2013 the correct date to release this? If you look at the lower right-hand corner here, these are war room notes from the team. This is on October 4th. This is after the deadline. Report, no testing started. So end-to-end testing of components of the system wasn't even complete on October 2013. Kathleen Sebelius, the head of HHS, said on October 23rd, we pushed forward because millions of people have been waiting for health insurance. In other words, it was okay not to have the system complete, but we had to get it out because there were political reasons, essentially. So a system that had a political deadline overruled probably engineers who knew you couldn't get this system out on that deadline. Lessons yet again learned. You need a strong and enabled set of leaders. You need someone who's able to go to the key stakeholder, such as this fellow once was, to say you can or you cannot make a deadline and give that hard choice to that stakeholder. In this case, there was apparently no prime. HHS had never managed a project this big. You had a lot of coordination between 55 contractors, and you didn't have this level of strong enabled leadership. This is the one key lesson in a NASA study on leadership that was repeated over and over again. Projects succeeded because of the leader. That was the one common factor in project success. You have a big system like this and you don't have a one common leader, you have trouble. The corollary to that is that you need backing by the key executive. Now, it's true that discussions in the White House were frequent on the status of HealthCare.gov, but apparently they were discussions between people who weren't being made aware of what was happening out in the ground. Obama was unaware of problems until a couple of days, apparently, after the launch. And so what was happening in the trenches was not making it up to the executive, which leads to this. You need to communicate constantly and completely at all levels. HHMS was warned in the spring of 2013 by McKinsey that the program was off the rails, but the commander-in-chief didn't get that message. It didn't make its way up the chain of command. And so full communication had not been put in place on this project, apparently. We'd already mentioned that the requirements need to be kept stable on a high, on a stressed system like this, where you have a fixed date. If they're not, if the Supreme Court weighs in, if politics pulls states out of participation, you're going to get requirements volatility. And another key lesson learned, a great book by Joe DeMarco of Rational Software, who never missed a project deadline, said that he never missed one because he tossed features. He made the date. He just went back to his key stakeholders and says, okay, what do you want to get rid of? So King Solomon has age-old advice to teach us in project management. Toss features, keep the date. Pick one. You don't get both at the same time. And that message needs to be communicated needed to have been communicated from the start and fully as the project went forward. If you want to put in verification, then you're not going to get October 13th. You still want it? Another problem that emerged on the project was testing, end-to-end testing in particular. This chart was also taken from documents that were submitted to congressional testimony showing the process that was followed. And it shows here how there were basically a waterfall process with some iterations, but that was the plan. It actually ended up being much more monolithic, where testing was bunched toward the end. Now, in fairness, the actual documents that CMS, Centers for Medicaid Services, submitted earlier in presentations they did conferences showed monthly sprints with quarterly releases, alpha beta testing during release. So the plan, and to some extent, I guess, the process, was to do sprints and to do testing. However, apparently end-to-end testing was not done. And the proof of end-to-end testing not having been done was something called the 834 error. 834 is a form that's submitted to insurers. It needs to follow a certain format, and it's unclear why the 834s are a problem. What's happening is that insurers are getting forms that have a variety of misinformation to them. And this indicates that end-to-end testing had not been done. If it had been, the errors wouldn't be bunched now at the back end with the insurer interaction. Another question, and an open one at that, is why the system wasn't purchased off the shelf. Oracle had introduced what's called a HIX, a Health Information Exchange solution, as had Microsoft. Firms like Towers Watson are in the business of developing health exchanges for unions mostly. And then you have all the private web insurers that already exist. eHealth, GoHealth, Get Insured are just one of 34, apparently, contractors, or rather firms that are out there that provide online health exchanges. They are slowly being folded in to the Affordable Care Act, and they are being enabled to sell insurance plans. Currently, no subsidies can be calculated on those sites. However, it could be argued that this system never really needed to be built, that the administration could have built a hub, which was the core data provider for all these service exchanges, and then enabled current online exchanges to carry the weight. Or they could have purchased off Oracle and Microsoft. I believe some of the state exchanges actually did go that route. Another lesson I think we can learn, there's been a lot of rotten tomatoes thrown at the contractors here. People have been saying, why don't you just hire Google and Facebook to do this? Well, Google and Facebook already have work to do. It turns out that all the large contractors out there, the CSCs, the SAICs, the Lockheed Martins, the CGIs of the world, they do government work. They all are already government contractors. You can't blame the entire contracting community, and private industry is already employed. So it's not fair to blame the federal acquisition regulations to the extent they have been. Much has been developed over time for the government very well by private contractors. Finally, you have to remember, they had to remember, that the political process, which demands absolutes, was mated with something which is not an absolute. Software is inherently difficult. Black swans may be unusual elsewhere, people just discovering what a black swan is, but anyone who's involved in software knows that black swans are lurking everywhere. A key issue, we believe, with the entire project was that reliable estimates were never presented up front. Of course, that's where Galorath comes in, and it had reliable estimates been provided up front, some hard reality could have been thrown in the face of key stakeholders, and October 13th or various features of the system could have been sidelined to make the date. That's it for my portion of the presentation. I'm going to turn this now over to Lev. Lev, are you there?
I am. Can you hear me?
Yes, I can.
Good.
Here you go.
All right. Well, thank you. And thank you for the interesting expose of some of the documents and things that have gone on here. So I am with CAST, and just a brief intro. The perspective I'll be coming from is one actually that Lee, I think, just alluded to by talking about black swans and software being hazardous. CAST is a software analysis and measurement firm, and what we do is we focus on actually analyzing and measuring the source code level, if you will, or of the software, of the product that is actually being developed or maintained or being enhanced or anything being done with the software product in order to get control over that sort of X factor that often lurks in software from a risk standpoint, but also to get insight into what's going on in the software development process and life cycle, and where things stand. If you could flip to the next slide, Lee. So we, yeah, there we go. Okay. Next, yeah, thank you. So a lot of this has been stated, and I think many of us on the phone have been looking at HealthCare.gov and seeing what's been going on. And, the concept of Death March kind of, from my old project management days, that certainly comes to mind. And I'm not going to rehash any of this. I think Lee summed up very well what some of the issues are in terms of, requirements and delayed requirements and things like that. One thing I want to mention here is, this is a very complex sourcing environment, and that's something that's often forgotten in project planning. Whether you have multiple vendors, like 55 is certainly an extreme number, but even 3 or 4, that are scattered in multiple locations, or even your own team that may be, from multiple departments, that are working on a complex system. It's the sourcing and the organization of development sometimes very much gets in the way of getting a product out the door. And I think we're all aware of that, but I think this situation at the extreme has shown us how much of an impact that can have. So obviously testing was truncated. We saw some evidence to that effect earlier on. There's some functional issues here as well. But actually, I think the architect of at CMS testified in Congress saying that something like 30% of the system wasn't even built yet by the time of rollout. But the thing that we would stress here is that it's very important, and obviously there are many things going wrong here with a project like this, but it's very important to be measuring the product as it's being developed, right? And this is where one of the areas where we saw this project go wrong. And so in terms of sort of looking at the hard reality of what goes on during a project, one of the things that you see frequently in project status reviews is what some of us refer to as watermelon charts, or some of you might think of them as the traffic light charts, but where the traffic lights or whatever, the symbols look green, but they're really red on the inside. And if you're not looking at the actual asset as it's being developed, you can't really see what's on the inside, right? And so you're getting perhaps not the most objective impression of how the product is evolving. One of the other things that we would say here is that, in terms of the executives and the politicians involved in this project, or in any project at any large organization, the project sponsors tend to be sort of politicians in their own way, and I'm sure all of us have seen that as well. But, having that kind of tangible evidence throughout the cycle in terms of how that product is evolving is important from a go-no-go standpoint, to be able to see and to have the kind of hard facts to say that, well, not only is testing and, certain steps in the project are not complete, but here's what our asset looks like today. And so here's the risks that are in it. And based on that, we can perhaps push back a little bit on the politicians in our organizations to say, what the risks really are, and have a real assessment before we actually launch. And this is something that obviously wasn't happening here. So, and of course, we'll talk about the sourcing a little bit more going forward. So why don't we flip to the next slide, Lee? Thank you. So one of the things that we did when this situation broke in early October is we actually took a look at some of the code that was on the front end, right? All of us know that you can take a look at what the browser is downloading, right, and what that code is and what's being run by Internet Explorer or Chrome or whatever it is that you're running. And, that's the very tip of the iceberg. Lee did a nice job showing how multi-tiered this architecture is, 5 different tiers, and, how complex it is. And it's actually funny that everybody refers to this as a website. I think of building a website as a weekend project, but, this is not just a website, clearly. But, taking a look at some of the website components, what we could see are some very basic issues. And if you guys remember, early on, the problems that people were having were very much performance issues, of the site timing out, not being able to load pages, and, having issues like that of just kind of getting on to browse and to register. And so what you see here are 5 times as many JavaScripts loaded than you need, not being cached online and on the client and being reloaded every time. So the JavaScript was not optimized for website responsiveness. Just some very basic things, heavy fonts, a lot of analytics, Google Analytics and a lot of other website analytics, client-side analytics that were being loaded and being used, way more than you need to track any website. Just a lot of things from a performance standpoint that are heavy. And then, digging a little deeper, we saw some issues that, we've actually reported back to the CMS team, and they've since fixed, so we can talk about them. But, there's some issues with the verification key being exposed right in the website without having to go to email. So you could, basically take that key from the website if you're a hacker and spoof others' accounts and create all sorts of havoc. That's been fixed. Some text injection issues. So lots of kind of code structural cleanliness issues that, if you were measuring and managing the structural quality, the code quality aspect of the website, and maybe, this project was, but, if that's something that was being paid attention to and measured over time, then these are the types of issues that would at least have been flagged and would have been deployed knowingly if that were the case. And so, as we remember, these are the types of issues that were causing a lot of performance issues up front. Many of these have now been fixed, and the team has moved on to some of the deeper problems in the interconnections. If you can move to the next slide, please, Lee. What we would advocate in terms of what should have been done is continual analysis of quality. And the way you look at that, right, is that you look at the components and you look at the system level. You need to be looking at each of the JSP pages or JavaScript pages that get loaded to the site or to the client. You need to also be looking at the whole system in terms of the multi-tier architecture. Here's a stylized version of such a system, and how those components are interacting with each other from a structural standpoint to see where some of the issues may be. And that's something that we would advocate be measured continuously. Obviously, full end-to-end testing, I think we've heard about that a little bit. Primarily, that testing tends to be functional. And then, obviously, you'd want to do performance testing and stress testing as well, end-to-end. And that's something that from a performance capacity standpoint, you can do to address some of the issues. Of course, you can never stress test your system enough, especially with short time frames. But, clearly these issues have, or these techniques have not been fully applied here. And lastly, of course, penetration testing from a security standpoint, that's clearly with health data, that's very important. And that's something that, we saw some evidence to the counter that that whether this type of testing actually took place. Okay, so we can move on to the next slide. So one thing that I want to highlight here from a quality standpoint, especially with a multi-tier system like this, a multi-component system that's being built by multiple parties and being integrated. We've done a fair amount of research on this at CAST. We've actually seen some of the research done in industry as well. And I want to show a chart here that we've seen recently that shows, and this is an eye chart, and you don't have to read this whole thing, but basically the stuff in gray is a sum of all the kind of defects and flaws that you might see in source code by looking at issues at the technical kind of the structural source code level. And what you see, and the stuff in orange are issues that are more integration level issues that are multi-component interaction issues. And so what you see is that, looking at the bar chart here, is that actually 8% of all the issues that you might find are multi-component level, whereas the rest are, just kind of local cleanliness, kind of code quality issues. But those 8% account for roughly half of the repair effort, and when you get into production, into live system use, they actually account for almost 90% of actual downtime and outages that are experienced. So, I think most of us that are involved in software development know that integration and multi-component issues are the ones that are the hardest, the trickiest to track. And we see, I think we're seeing a lot of that with this quote-unquote website that is being rolled out with HealthCare.gov. And I think that's the issues that we're starting to really dig into now with the integrations to multiple exchanges and multiple carriers. Okay, and the next slide, if you will. And so that's my last point here. Basically, in terms of how you should be handling or how this project and any complex project should be handling QA in a complex supply chain. So, as we mentioned, this is a particular example of a complex supply chain, but we see analogs to this in other industries, right? In manufacturing, for instance. But what you want to be doing is you want to have measurement interfaces so that with every vendor, every contractor, and really every team, every component of the system that gets developed gets measured and gets a scorecard. And in important cases where it's particularly complex or a critical part of the system, SLAs are placed around that scorecard to make sure that anything that is not up to spec in terms of structural quality, that doesn't measure up, it gets turned back for rework before you even integrate. And then when you integrate the system, you need to take an end-to-end measure of that system from a structural standpoint to see where those black swan type of risks actually lie and look at the scorecard of that system. So, and this is really the scorecard that you want to be reporting to management and to the project stakeholders to let them know whether you're a go or no-go. In addition to, of course, stress test, performance test results. But this is a one-time snapshot that you would want to do before you decide to move on. And so this is something that should have been clearly implemented in this process, in this project, I should say, and clearly was not. So that's it. That's basically our perspective, and it's a bit of a technical engineering perspective, but a lot of the issues that we saw come out with this website were technical and engineering issues in nature that surfaced. And so with that, I just want to turn it back over to Dan, I think, to go on and talk about some of the estimation issues.
Thank you, Lev. Next slide, Lee. While we're talking about HealthCare.gov, it's always important to talk about how we get into some of these things. And part of the problems, we've heard of a number of technical problems, but part of the problem, and a large part of the problem, really is a planning problem. Now, I'm not saying they didn't plan correctly, but I'm saying that they probably didn't have a vision of what it really was going to take, how long it was going to take, how much risk there was in it. And having a viable plan up front is one of the big lessons learned. Additionally, every estimate is we believe every estimate should be a probability distribution. There may be a 50% probability something can be done in 3 years, but 90% probability might take 4. And we'll talk about that in more detail in a minute. Next slide, Lee. Part of the problem is humans are optimists. It's not that we don't try to do a good job. It's not that we're being dishonest. It's that we think we're going to get it right this time. And a wonderful article from the Harvard Business Review that explains this phenomenon. We're all wired to be optimists. So as technical people, as program managers, we think we're really going to get it right this time. Next lead. Now, one of the solutions for that optimism is to temper with an outside view. Again, this comes out of the Harvard Business Review article. To have past measurement results, forecasting, risk analysis, and statistical parametrics that can help give another view. Now, for example, if this was estimated optimistically, as it obviously was in some ways, even though the requirements were changed and things like that, there's still some optimism here. Don't remove the optimism, but put in balance of realism. So we don't want everybody to be the sky is falling all the time, but an ideal estimate and plan shows what really can be done and what the probabilities are, so things can be managed appropriately. Next, Lee. Here's an example in the software development piece of what happens. There's a minimum time to get any particular software job complete. Now, you can ship earlier, but it doesn't mean it's complete. And in addition to that minimum time, there's an optimal effort. So if you're worried about cost, there's a time that might be a little longer that can be more cost effective. But understanding that minimum time is critical to appropriate planning. Now here we can look at the minimum time of one contractor or one program, but now we had over 20 of them. Putting them all together becomes very complex. Next, Lee. Next again. Another thing in looking at systems like this is looking at the total ownership cost. Now this system had a requirement. It had to be there. Nobody could say, gee, it's not worth the time or the effort or the money to do this. But looking at total ownership cost is an important part of the pie that we haven't even begun to address, as far as I know, with HealthCare.gov. The way it was put together, the complexities, the numerous contractors and things are going to make this a costly and difficult system to maintain and go forward with forever. Next slide. Looking at some of the cost information, for example, we know that roughly the software development costs, we can pull them out of the various documents as Lee had talked about. Unfortunately, software development is about 10% of the pie. So if you look at if the original number was $300 million in development, this could be over $3 billion in total ownership costs, including the software development, software maintenance, IT infrastructure, IT services, help desks, and things like this. But it's got to be done. So this isn't a case where they could have said, no, we won't do it. Perhaps they might have said, we'll do it a different way. But there's a lot more to come. This is going to be a difficult system to maintain, a costly system to maintain, but it's needed. Next slide, Lee. Here's part of the issue. Mandated features. You got to have these 100 features or whatever it is. They're needed within the time that's given. It's got to be by October of 2013. And here's the resources. Here's your budget. Given all those things, something's got to give. Now there's a thing called the iron triangle that's talked about in project management. It talks about the scope, or how much features and functionality are needed, the resources available to build those, the schedule upon which they're built, and in the middle of this is quality. If you don't give on something, quality goes down. Now, as Lee said, throwing out features or tossing features is one way to reduce schedule and not violate quality issues. Some people might say, well, they had to have all these features, and that's probably true, but perhaps there was a way they could have incrementally put some of them in. Now, again, we can't really Monday morning quarterback every decision made within HealthCare.gov, but what we do know is this is the typical kinds of things that happen is we have a schedule that is nearly impossible, or maybe is impossible, a set of features that we can't do them all, and nobody's saying, okay, here, just do it this way. Go ahead, and we'll defer these features. Software is not magic. IT systems aren't magic. I wish they were. Next slide, Lee. And looking at this another way, you can have it really good or high quality, really fast, or really cheap. You can pick two of them. You can't do all three all at once. Lev's example of the code and the extra measurement and the extra things. You know, the typical way you build software is you get it running, and then you go in and optimize it, get it running well. It looks like they just ran out of time and didn't have time to get it running well. They would have probably found those multiple things in the JavaScript and there was 5 different analytics tools and things. And as I'm sure they've done now, they're removing the things and optimizing. Next slide, Lee. Here's part of the issue, quickly. If you look at a particular project, and here's our plan, click again. To get it done, there's an optimal number of people you can put on the project. If you put too many on it, and I say project, HealthCare.gov was many of these projects. The whole program was dozens of these projects. But for each individual project, there's an optimal number of people. If you have too many, next Lee. If somebody doesn't give you the amount of people you wanted, in this example here, you needed up to 10, and they say, hey, you got 7, well, you can still deal with that. Next, Lee. Up front, you've got some good work getting done by those 7 people. It's moving progress towards the goal. Next, Lee. Unfortunately, up front, you probably didn't need 7 people on this little piece of the puzzle, and some of those people are kind of getting in the way, or at least not being productive. But that's okay. Still, we made progress. Next, Lee. Now, if you want to get it done within the minimum time, increasing the staff as the development goes along is the best way to do that to the optimal level. In this case, we only had 7, so we ended up with not getting everything done. Click again, Lee. So all that work needs to be done. Click, Lee. Which means the project gets later. The point here, I'm not saying that they had the budgets or had the resources, but if they could have planned for those, they probably could have got some of the things done in more optimal time frames. And in looking at projects in the future, using and honoring that minimum time can be very helpful. It's part of what's called Brooks' Law by Frederick Brooks. Next, Lee. Next one. Now, part of what happens, and you can see in the background there, we've got some of that scary chart that Lee put up earlier with all the different pieces, and he said this wasn't everything, but every interconnection with over 20 contractors, each contractor, over 55 contractors, many of the contractors had to communicate with each other. Every time you have a communication patch, you have more problems and more time delays and things like that. It happens at the lowest level with staff. A project with 20 people has more communications issues than a project with 10. But looking at 55 different contractors, the problems are just orders of magnitude bigger as communications issues abound, and the project gets less and less productive. Now, I'm not saying it should have been done with one contractor either. I'm saying this is a hard problem, and having hard problems, we have to deal with them. Once again, planning and understanding what the realities are going to be is important. Next slide, Lee. Now, I know you can't read this one. We'll look at it bigger in a minute. But one of the things I was got a chuckle out of one of the articles I read on HealthCare.gov, and in that article, the guy said, well, everybody's quoting Brooks' Law, which says adding people to a late project makes it later. And he said, oh, they're wrong, because Brooks' Law says it'll be later. They already shipped the project. And I thought that was kind of funny because, yeah, they shipped it, but it obviously wasn't ready. So the project wasn't ready to be shipped. Let's look at what happens when you ship early. Next slide, Lee. Here we can see a chart that shows what happens defect-wise if you ship early versus later. Go ahead and click, Lee. If you ship in this little project, at the time that was estimated as to be good enough, you'd see about 65 delivered defects. It's virtually impossible to reduce defects to zero. Well, let's see what happens. What if you ship early? Next, Lee. In this example, if you ship this project 8 months early, that would be about a 400% increase in the number of defects. So shipping early, well, you might make a milestone checklist somewhere. You can end up with disasters and programs as we see so often. Click again, Lee. Some people say, well, let's just test forever. And again, it's almost impossible to get to zero defects. In this example, and this is a small example, but testing for another 6 months can reduce the defects from 65 to 16, but you can't ever test to zero. There's a point when you've got to feel the system. And as Lee's chart showed earlier, there's going to be a point where we know there's defects in every system, and going to be a couple of rocky months perhaps, but understanding what the impact is and being ready for it is key. Shipping early, shipping before it was ready, as they were forced to do to meet the deadline, was bound to have happened what has happened. The lesson learned here, of course, is that if we can control and understand what the risks are and the elements are, perhaps we can do better. Perhaps we can defer functionality. But there is a minimum time to get any software job done right. Next slide, Lee. Now, another thing is, as Lev talked about a little bit, if we look at what's happening during the development and look at the number of defects they're finding and the number of defects they're removing, that can be a key indicator as to how the system is going to perform and when it's really ready. In the example on the upper right corner here, we see the red line is an estimated number of defects that should be found. The blue line is the actual number of estimated number of defects that should have been repaired during that time. The green line is the actual number of defects found. In this example, they found more than they expected. You can argue if that's good or bad, but the other line, the sort of purplish line, shows they've repaired fewer than were expected. So we found more, repaired fewer. This project's in trouble. A project manager would want to know that, and as would everybody else, and go in and spend more time or more energy on those areas that are getting in trouble. This kind of data can be very helpful to figuring out when a project really is ready to ship and how to manage it best to get it done. Again, this is showing one small piece of it. Multiply it by the hundreds of pieces it had to fit together here. You've got a pretty frightening picture. Next. Now, we talked about using package applications. We haven't done sufficient analysis to know if a package application would have made the system better or not. And we're sure competent people did that analysis. But even had they used a completely packaged software, about a third of the budget needs to go to testing. People often assume in packages, and there were some packages used in HealthCare.gov, that they don't have to test it because it's working. Well, that's a disaster in the making as well, because testing of everything has to be done. Just the fact that it's been configured right, that it talks correctly with other components. There's defects in the package software as well, so it's not a magic bullet. It can be very helpful, but it's not a magic bullet by itself. Next. One of the things to do in planning is to actually do estimation in an appropriate way, and there's a 10-step process we've published some time ago. You can find details of it on the web. On my blog, for example, Galorath.com/WP. I'm not going to go through these 10 steps, and I don't care if you use 10 steps or 7 steps or 16 steps. What I do care is that the various components are done, that there's a logical progression, that the ground rules and assumptions are written down, that the sizing and the scope is done appropriately, that after the estimates are done, is that the people verify that you can actually build the system, or if you need to go back and replan the system. So having a process for estimation and planning, we believe is critical, and this is the estimation process. Next slide, Lee. And one of the other things to consider in looking at new systems, Lee talked about how requirements came in near the very end. Requirements growth is almost a sure thing. In this example, we can see here is showing that requirements can grow up to about 200% of the original requirements, oftentimes very early in the process. So when people are first conceiving things, it's probably going to grow dramatically. As Lee said, too, there's ways to control and say, okay, we got to have these new requirements, but let's do them in a controlled way. But if someone plans for a system and doesn't assume the requirements are going to increase, they're in big trouble. And there's wonderful tools to estimate these things. You can use tools. We've got size by comparisons, and CAST can do functional size by running code on it. And there's also databases like the ISBSG, international database that collects data on software programs. There's lots of ways to figure out how big the things are going to be. Again, there are many programs involved in this, many projects involved in this program, and it's important to size them and to recognize that there's going to be growth, and growth costs a lot. Next slide, Lee. One of the other areas where people often get in trouble is on reused software. They assume, again, it's going to be fine. There's a significant retest in reusing software, whether it's off-the-shelf software, whether it's internal software, as well as having to redesign it and re-implement it, looking back into it and re-architecting it to make it work with a new system. So another lesson learned is watch when somebody says, oh, it's reused, it's going to be free or cheap, we've got problems. Next slide. Now, there's more. If you look at IT services are a large part of that whole puzzle. And here, an example we ran looking at something like HealthCare.gov, there's limited tolerance for downtime. Now, we've had downtime, but everybody wishes there wasn't. So the plan should be for a goal level, a top level service level agreement kind of staffing. And here you can see the graph on the right showing up front you need a lot of people. And even after the program is fielded, it's going to need a lot of people to verify and keep the system running. So planning for a staff, an ongoing staff that will be, even if there were no problems in the system at all, is an important part of the total ownership costs. Next slide, Lee. Looking at what happens if you've got more potential concurrent users. HealthCare.gov may have had a requirement of up to 50,000 concurrent users. Well, there's a lot of significant IT effort involved in ensuring you can have a system that can run 50,000 users. By the way, how do you test 50,000 users in a test environment? Well, you can, of course, but it's a huge job to do that. In the example chart on the right is showing going from 10,000 users to 10,000 concurrent users to 50,000 concurrent users is about a 40% increase in total test time. Recognizing there's huge costs associated with concurrent users and planning for those is another lesson learned here. Next one, Lee. Again, having people that are not skilled in using the system is a driver. Now, nobody goes to training, hopefully, on how to use HealthCare.gov that isn't, it's just buying insurance. But and that's fine. But there's going to be a pain involved in supporting any system. And understanding that the minimal user skills is going to provide additional support is another another key factor. Here we can see in the graph there the costs associated with untrained versus trained users. And hopefully HealthCare.gov is a one-time thing. It shouldn't have to go through training, and that's fine. But there's going to be help needed, and planning for the staff to have that help is critical. Next slide, Lee. Another thing we've heard about some of the scary security things. Testing systems to be ensure they're secure is very difficult. Lev talked about how some of the things we can do with static analysis and code analysis, and that's wonderful. And additional testing to certify the software secure is very expensive. On the chart on the upper right, we can see if when it says nominal, if there's no testing required at all, no security required at all, that's 1 times the cost. If you needed the highest levels of security, it could be 400% of the overall effort. And so planning for security and testing for security is another critical thing that needs to be factored into the system testing and system design as well. Again, we're not saying whether HealthCare.gov did it or not, but they certainly had a big challenge in ensuring that the system was secure. Next slide, Lee. Risk analysis. We could spend hours talking about risk analysis. Lee talked about black swans, and black swans is a term that came from, there was a time when people used to use it, I guess, it's as probable as a black swan, because in England they didn't have any black swans. Well, then they went to Australia, and it turned out there were black swans. So the old saying, as probable as a black swan, which meant it wasn't going to happen, was totally blown up when there really were black swans. Well, looking at cost and schedule and risk, we've got black swan is something that we couldn't guess it was going to go wrong. That does go wrong. But there's lots of other factors. For example, even if we just had 3 independent elements, and we can multiply this by hundreds for HealthCare.gov, and we had a 90% probability of getting each of them done, well, if that's 90% times 90% times 90% is only a 72% probability for them all being done successfully within that schedule. So there's more sophisticated risk analysis can be used. And if we just use a point, next slide, Lee. We just use a point. For example, this is an estimated schedule. And we can see step 1 is 30, and step 2 is 50, etc. Add this all up, and these 10 activities is 500 days. So if we just took these and said, hey, we got it, this is 500 days. Well, life would be good, right? Next slide, Lee. Well, life wouldn't be good. If we do it a little better and look at the uncertainty or the risk, and you can see in step 1, the best case is 27 minutes, likely 30, and worst case is 75. If you do this for all these things, you've got a big range you can see on the bottom, from 452 to 1252. But really, to do this right, we really should do a real risk analysis. Next slide, Lee. Running something like a Monte Carlo analysis, which is one type of risk analysis, would generate a curve something like this, showing the probability of different things happening. Click it, Lee. The original in this example, the original 500 days has about a 0% probability of actually being achieved. So by using statistical risk analysis, we can find out what the probabilities really are. Next, Lee. Now, it turns out a 50% confidence, or most likely, this project will take 731 days based on the information on that prior slide. What if we planned for 500? What if we told the highest levels of executives in the company we could do it in 500? We're in big trouble. Next, Lee. Now, with a 90% confidence, that's that it won't, the 90% probability it won't be exceeded. This particular project's 817 days. The real point here is you need to do risk and uncertainty analysis in every program, every project. And do it well. I love Lev's comment about the watermelon chart, green on the outside and red on the inside. Find out what might be red early. Next slide. So what we've tried to portray here is that HealthCare.gov was extremely difficult. There was volatile requirements, huge complexity, extensive integration, legacy systems, and enforced deadlines that may not have been achievable. And the lessons learned yet again that we see happen in programs. We need strong leadership, and executives need viable information to make decisions. Communication is critical at all levels. Communication is costly as well, but not communicating can get programs in big trouble. The iron triangle rules. You can have it fast, you can have it cheap, you can have it quick. You can't have it all at once with a fixed date. Including risk analysis and plans and practice is critical as well, we believe, for viable, successful projects and practicing risk management. Testing early and end-to-end is critical as well. Make sure the system does what it should, and by the way, not just in the nominal case, but stress case conditions. Don't blame the developers. I mean, there's an awful lot of very competent people working on every software and IT system. We have every reason to believe that there were extremely competent teams of developers on these systems. They had hard problems. They had difficult deadlines. And use commercial off-the-shelf software when viable, but remember, it's not a panacea either. So the bottom line here is estimation, planning, and control can help, but mandate the possible, not the impossible.